Turning now to the battle against the coronavirus and some startling new numbers. It comes amid a new study finding that patients hospitalized with COVID-19 are far more likely to die than if they'd been hospitalized with the flu. I spoke earlier with Dr. Irman Ali. Good morning, Dr. Ali. Thanks for joining us. Let's start with a new study that found COVID patients are up to 5 times more likely to die than people with the flu. What do you make of those numbers?
Well, Andrew, we always hear that the flu is more deadly than COVID, and it's just not, because COVID doesn't only affect the lungs, it affects multiple organs. So COVID is just a totally different disease from the flu, so it's definitely deadlier. And this study really, proves it.
And this really got our attention. According to the CDC, the U.S. has seen about 300,000 more deaths than usual this year, and not just from COVID. Hispanic and Latino communities have been especially hit hard. What's to blame there?
And these are not directly from the COVID infection itself, but is in due part to COVID infection. A lot of patients were not able to see their doctors regularly. Cancer treatments were halted. And, these minority groups are, more affected because they had pre-existing conditions. They weren't able to have access to their physicians. A lot of the local community health centers closed down. And telemedicine, although it does work, a lot of these communities simply don't have access.
And let's talk about vaccines, because a new poll finds that only 27% of people say they would definitely get a COVID vaccine, even if it's approved by the FDA. What are your thoughts on that number, and what can be done to inspire more confidence?
Well, that's only one poll, and I do hope that people are going to have more confidence. The trials that are going on, especially the ones that are being held by the NIH, are undergoing rigorous safety protocols. So I think people should be more confident in the vaccine. We need at least 80 to 90% of the population to be vaccinated to have some sort of, ending this pandemic, ending the transmissibility.
And so that's the thing, right? It's not a matter of if there's a vaccine, but when, and now inspiring confidence in people to actually go get the vaccine. I mean, if there's a vaccine, nobody takes it.
That could be problematic. And we're already seeing Governor Cuomo outline a draft of how he would like the vaccine to roll out, starting with essential workers, for example, healthcare workers and those that are high risk, then going to lower risk essential workers, and then the general population, which might not happen until early next year.
Right.